Welcome to Talking HealthTech. I'm your host, Sophie, and today I'm joined with Landell from Pexip. Welcome.
Thanks, Sophie. Nice to be here.
It's great to have you. Can you tell us a little bit about who you are and what you do?
Okay, I started out as an exercise physiologist and quickly got into healthcare and sports technology. So I've been 15 years in software. I now work with Pexip, and they're a video conferencing company who work in healthcare and defense, government, and even justice. So it's all about secure video communications, and I'm in a product and sales role there.
Wow, I love that. I love talking to clinicians that have made that transition into this whole new exciting world. It's all very new to me in the last 18 months. I love hearing how other people and where they've come from and where they are now. So you have quite an exciting role at Pexip across those three verticals. What are you seeing? Because I imagine there's a fair bit of AI that sort of happens in the other verticals, and we're really now seeing that emergence, and it's very topical in healthcare at the minute. What are you seeing? How are you seeing it being integrated in healthcare at the minute?
Well, as part of my role, I get to talk to people who are at the forefront of AI in healthcare. So the other day, for example, I was talking to Olivier Salvato from CSIRO, and he had some great examples of AI's potential in healthcare. So he was talking about things like AI plugins for telehealth so that physiotherapists can measure joint angles and range of motion. He was talking about AI for wound care management so that you're getting objective feedback and you can characterize the wound and then have quantitative and objective feedback about the progress of that wound. He was even talking about generative AI to come up with new drugs. But the exercise physiologist turned health tech professional in me looks at this potential and just looks at, okay, great, some of these are really good ideas, but what problem are we solving? So does a AI plugin for physiotherapists, does actually measuring angles and range of motion have anything to do with the patient's function? Maybe not. For the wound care, are we focusing on now solving the wound, but we're not focusing on preventing it? And if we're coming up with new drugs, is that really what we want as a society? Or, and I know that we do. I know that there's always a need for new medications, but I think we've gone so far down that track rather than stepping back to focus on preventative medicine. And shouldn't AI be so helpful to us that it gives us time back in our days that we can actually focus on that preventative medicine? So I think there's a lot of potential, but yes, I have a healthy dose of caution and skepticism along with it as well.
Yes, which leads us nicely into your keynote that you have been doing, which is around sort of the cautious revolution of AI. Can you talk to that a little bit and what your perspective is?
Yep. So AI, it's moving so fast that, you've even had some companies who are behind acceleration reaching out and asking for a pause on the industry just until we can catch up and get ahead of what the potential human effects are. That pause didn't happen. A lot of this is driven by financial decisions, and you've seen companies like Nvidia's share price go through the roof. So ethical concerns and data privacy are talked about a lot. So you can listen to any podcast and they'll list a whole bunch of ethical concerns and problems with data privacy. This morning, I was actually listening to a podcast about responsibility to your moral community. So I get it, and I do a little bit of an eye roll and I giggle about how these questions are never actually answered. They're just kind of lead to pondering more questions about the purpose of humanity. I think in my space, so I work across healthcare and defense and justice and government. So these are highly security conscious, privacy conscious organizations, and they are grappling with AI because they can understand the potential of it, but how are they going to lock it down and train it in a way that's going to work for them? And so we're working hand in hand with them to try and figure that out. But I'm just seeing, you put AI onto a cloud and vendors expecting you to consume that because it's giving you so much potential. So one example of this was I was on a recent video call with our Salesforce team. And so Salesforce is a CRM. It's used for back-end business management. So it takes all of the data from sales calls and pipeline management, all of that type of thing. I'm sure most of the listeners have heard of Salesforce. Now, Salesforce was telling me our AI can really help you because it can summarize your call notes. It can add those to your CRM. So it's all of those notes and a summary of what you've talked about with clients will be there for you when you go back to review them and work with these clients as you move them forward through a pipeline. And the presenter was, I guess she just didn't know her audience because she was talking to a company who deals with highly security conscious organizations. And she was saying, you know, it's okay. It'll listen to your phone calls. It'll scrape your emails. It'll make a summary of all of that and it'll put it into Salesforce for you. And the team and I, the global team, were just like, there is absolutely no way that that is happening. Yes, it would be lovely if we had an assistant that we trusted to be able to take notes and put in data entry and be able to do all of those tasks that, you know, they're just so time consuming in your day-to-day work. But there is no way that we are trusting a cloud service and that company to scrape our calls and emails to be able to provide us that service. Other examples I've seen, so my husband and I work at home a lot. He works for a security company and they've built up their brand. They often win, you know, those most trusted brand awards globally. And they've brought some AI into the market that can also read your calls, read your messages, read your emails. But what that company is doing is searching for scams and helping you prevent them. So that company's built up 10 years or 20 years of trust in the market. They're already solving your problem. They've already cleaned up your, you know, they've prevented your computer from getting viruses. They've secured it. They've worked on your identity. And now they've brought a product to market that's also going to read those emails, but genuinely give you a solution. So I guess my point is, one of the things is you're in a cloud service and that's provided to you by a company. Are you trusting that cloud service? And are you trusting that company to provide you with the user experience that you think you're going to get while securing your data? It's a big question.
Yep. It is a big question, and it's, you know, you're so right. Like we skate over the patient data and privacy and security, and it will all, yep, it's all happening, or we've got that covered. But you're right. Like that example that you use is a great one in terms of just what is getting scraped and where does it end up once it is on a cloud. If we were to sort of look at the other side of the coin and what AI can do for healthcare. How do you see it contributing in like health equity and improving the patient experience?
Yeah, I think when we look at the potential of AI, it has to cover those that quadruple aim, right? It's not just about the patient experience, and of course we want to improve that, but I would really like to improve the experience of these burnt out clinicians, and I'd really like to improve health outcomes, and I'd really like to see lowered costs as well. So we have to measure it against that. The patient experience, for me, I think AI is a bit more about the clinician experience. I mean, I'm in this sandwich generation, right? So I have kids under 10 and I have parents over 70. And because I finished uni and did something that sounded, you know, I had patients at one point, my whole family thinks I'm the medical one. So that means that I'm in charge of mum's healthcare and her medication with heart failure and dad's cancer treatments. So as well as looking after my kids, helping out with parents. Then add a full-time job and add all of the social activities and the things that the kids are involved in, and just add life to that. And you have a really busy person who, I mean, I don't know how many other parents can relate to this, but I have a million tabs open and I have a million things unfinished. What I would love is if I could use AI to help finish some of those tasks. So could it come along? Could it learn what I'm doing? This is how I fold the washing, or this is how I clean the dishes, or this is how I work on a spreadsheet, or tick off tasks, or reply to emails. Could it learn those things from me and then execute on my behalf? So it's helping me to finish tasks. Now, that's me. Imagine a person who has patients' lives in their hands, who also have families, who also might be sandwich generation. The potential for this to be able to be an assistant to those type of people and actually reduce some of the strain and some of the burden and some of those tasks that they're on our task list and we have to get to them, but there's just not enough hours in the day. So I see AI really being on the side of the clinician experience, and that's where I see the real potential.
Sure, and certainly that's where it's having the biggest impact at the moment, I think, from that release, reducing that administration burden on our clinicians, particularly through documentation. Where then, in terms of what you mentioned previously in terms of cloud data, privacy, all being secure, and also that administration burden, how do you give someone back more time in their day? Where do you see the balance of all of that?
Yeah, it's a tricky one. One of the examples I could give is, okay, so most people know about public internet, public cloud, and they hear cloud and they just think, okay, it's on the internet. You can also use cloud in a private way. So you lock it down to your own organization. It has the applications in that cloud that you determine, and it has all of the security controls around that cloud that you determine. So New South Wales Health is a very good example of this. They'll run a private instance of Amazon Web Services, and they'll put a whole bunch of applications into that private cloud. I think the balance that we can find with AI is starting there. I think, you need the tooling that is on the cloud, but start with a private cloud. Don't just go straight into public cloud. The difference is you can have more security controls. You can actually control what it's integrated with, and you can control the machine learning and the data that those AI models are learning from. So the data that they're ingesting, rather than kind of popping up AI, and in its worst case, it can be just sitting up there soaking in data from a polluted sea that is the internet. Lock it down, put it into a private cloud, integrate it with other software that you trust, and you're going to be able to train it over time to really be more effective for you.
And then I guess from, looking at the stakeholders being, I guess we've got the healthcare, the clinicians, patients do play a part in that. And you've talked a little bit to that quadruple aim. Can you elaborate a little bit on that, and then how AI sort of pieces all of that together or enhances it?
So in an example that we're working on at the moment, okay, so Pexip deployed in that private cloud is the video conferencing engine. NVIDIA graphics processing units can also be put into that private cloud. So NVIDIA has all of that AI functionality, and they have APIs to integrate in with other software. So you put both of those together into a private cloud, and you now have live language translation and transcription. So for example, where you have a clinician who speaks English, but a human interpreter is on the telehealth call, for example, that human interpreter is then translating the English into another language. And there could be the potential for a mismatch between what the clinician has said and what the interpreter has put in front of the patient, and then what the patient has understood. With private AI and with this type of technology, we can use it so effectively in a few ways. So if I'm the clinician, I speak English, it gets translated to Spanish, and it goes to the patient. But I can also read on screen what the interpreter, the human interpreter, has said in English. So I can then confirm, okay, they've said exactly what I needed them to say, or I can correct them. Okay. Now, with human interpretation, it's often very, very expensive. It's very difficult to get someone at the right time. I think it's something like 120 languages in New South Wales are currently supported, but there's 240 languages or 350 languages from, I've seen from different sources that we speak even across New South Wales. So there's obvious gaps, and those gaps are being filled by family or friends who come in as the interpreter, or, they could be filled by something that has been trained on human translation, but then can do its own translation. So you still get that same user experience of, I'm the clinician, I can see, I'm speaking English, I can see the Spanish translation, I can make the corrections. But instead of being a human interpreter, we've now got an AI bot or a AI function that is doing that for us. And it knows our medical jargon. It can understand, because it's been taught, the words that we commonly use and how we phrase those, so that it can actually effectively communicate with the patient. So that's a really exciting it ticks the clinician experience box, it ticks the patient outcomes box and patient experience, and then it ticks the lower costs. If we can prove that there's cost savings from, running human interpreter services to actually augmenting them with AI.
For those populations where they're getting the translation through a bot, how do you maintain that human touch in patient care?
Yeah, great question. I always want the human touch as much as possible. And that's why I talked about the example of using AI to augment that human translation first. The human touch is still there with the clinician. They're just using an assistant, the best available assistant to them at the time, to be able to communicate more effectively with the patient. Sometimes that's a human, and that human is accessible and it's affordable to do so, and that's the best way to go. Sometimes that's not the best way to go. It's not possible. So to increase that equity, that health equity, and be able to provide the human care from the clinician, but translated for a patient who doesn't speak the same language, then these tools make that possible. We're trying to connect as a human, and if you're not speaking the same language, that's very difficult to do. These tools are there to try and help the patient experience, and help that human connection. And we just have to do it right. We have to know how to use them and when to use them.
Yeah, right tool, right time.
Yep. Yeah.
How do you see the future of AI in healthcare evolving over the next decade? And what are you most excited about seeing?
I think we're going to see a lot of startups in this space. And I think we will see a lot of people like me that are ex-clinicians and have some knowledge about technology spin-off companies. And I think we'll see some real problem solving and some real energy in the space. That's really exciting. I've started businesses as well, and I think having that energy around helping people but using technology to do so, I think that's a really positive thing. We don't always get it right, and there will be heaps of failed businesses for sure. But I think that pure excitement of recognizing the problem, having some clinical experience, forming a group with technical people and salespeople and business people, and actually getting products out there that really make a difference. I think we will see a lot of that in the next 10 years, hopefully. Hopefully, alongside of that, we'll actually see the increase of maybe part-time roles, or roles that allow you to see patients face-to-face for 2 or 3 days a week, and then do these technology projects for 2 or 3 days a week. That'd be my ideal role. Like if I still got to treat patients for 2 days and then have a tech role for 3 days, that'd be the best ever. So I hope we get to see more of a hybrid work environment that kind of caters to treating patients, being close to what they need, and then translating that into technology solutions that will, carry us forward. I don't want to call out too many specific examples, but I just want to make sure that the things that we're seeing that are coming down the line, that they're solving the right problem instead of creating more work. So I think, there's some real potential in like diagnostic tools, but say a diagnostic tool, an AI, can pick up a cancer before a human can, But that cancer is so small at the time. It's minuscule. It's microscopic. The AI picks it up. You have a group of experts who get around that to kind of make a cohesive decision about what to do with that patient. 9 out of 10 of those patients, I think, would just go into a monitoring phase, which they were probably doing anyway. So I think some of these tools are really great. And yes, we want to have new tests for things that we can't detect early right now, like ovarian cancer, for example. But for things that are just going to create more appointments that are just monitoring, I'm not sure that that's the best use of our brains. Like, I really want to solve the bigger problems with AI. And I want to solve them at a personal level that actually unlocks the potential of humans to provide that real human care, but just give us a really good assistant that helps us do the things that we do a lot better.
All right. And if to close out today, Landell, to wrap up a cautionary tale of AI, what would you like to leave our listeners with?
The thing that I will leave the listeners with is, if you can train it, you can trust it. If you're pulling it into a private environment, you're plugging it into the other bits of software that you trust. You've got the ability to train that assistant, essentially, train it in your data. Then you have the ability to trust it.
Landell, thank you so much for your time today. It's been a really insightful conversation, and I'm looking forward to seeing where AI takes us in the next 10 years.
Me too, Sophie. Thank you so much for your time.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.